Hay fever, also known as allergic rhinitis, is allergic reaction to airborne substances such as pollen, dust mites, or mold. It is characterized by inflammation of the lining of the nose and eyes and is a common condition, especially during certain seasons when allergens are more prevalent. Causes hay fever is typically triggered by allergens, which are substances that cause an allergic reaction. Common triggers include pollen. Tree pollen often causes symptoms in the spring. Grass pollen commonly causes symptoms in late spring and summer. Weed pollen typically causes symptoms in late summer and fall. Dust mites, tiny insects that live in household dust and are a common indoor allergen. Mold spores can be found both indoors and outdoors and can trigger allergic reactions. Animal dander, skin flakes, saliva, and urine from pets, such as cats and dogs, can be allergens. Symptoms. The symptoms of hay fever can vary in severity and may include nasal symptoms, runny or stuffy nose, clear, watery nasal discharge or congestion, sneezing, frequent, repetitive sneezing, itchy nose, discomfort or itching inside the nose. Eye symptoms, itchy, red, or watery eyes, inflammation and irritation of the eyes, conjunctivitis, swelling of the lining of the eyes and eyelids. Throat and ear symptoms, sore throat, irritation in the throat due to postnasal drip, itchy ears, sensation of itchiness in the ears. Other symptoms, coughing, often due to postnasal drip. Fatigue, can occur due to poor sleep quality from nasal congestion. Diagnosis of hay fever typically involves medical history and physical examination. Healthcare provider will review your symptoms and their duration, and may examine the nasal passages and eyes. Allergy testing. Skin prick test. Small amounts of allergens are applied to the skin with tiny needles to check for allergic reactions. Blood tests measure levels of specific antibodies IgE related to allergy triggers. Treatment for hay fever aims to relieve symptoms and may include avoidance. Minimize exposure. Avoid known allergens when possible, such as staying indoors during high pollen counts or using air purifiers. Protective measures. Use masks, keep windows closed, and wash hands and face after being outdoors. Medications. Antihistamines, oral medications or nasal sprays that help reduce sneezing, itching, and runny nose. Examples include loratadine, cetirizine, and fexofenadine. Nasal corticosteroids, prescription nasal sprays like fluticasone or mometasone that reduce inflammation and nasal congestion. Decongestants. Oral or nasal spray decongestants can help reduce nasal congestion but should be used with caution and for short durations to avoid rebound congestion. Allergy immunotherapy. Allergy shots involves regular injections of gradually increasing doses of allergens to desensitize the immune system. Sublingual immunotherapy involves taking allergy tablets or drops under the tongue that contain specific allergens. Prevention to prevent or reduce the severity of hay fever symptoms. Monitor pollen counts. Check local pollen forecasts and stay indoors during peak pollen times. Keep windows closed. Use air conditioning with clean filters to reduce exposure to allergens. Use HEPA filters. Install high-efficiency particulate air HEPA filters in your home to trap allergens. Practice good hygiene. Wash your hands, face, and change clothes after being outdoors. Avoid outdoor activities. Limit outdoor activities on days with high pollen counts. Conclusion. Hay fever is a common allergic condition that can significantly impact quality of life. Effective management involves identifying and avoiding triggers, using appropriate medications, and considering long-term treatments like allergy immunotherapy. If symptoms persist or are severe, consulting healthcare provider for personalized advice and treatment is important.